Well, I had a patient tell me one day, he's like, I went to this doctor and he gave me advice. He's like, put your foot in vinegar. He's like, Doc, what am I trying to make a salad with my foot? He's like, you can do that at home, but don't bring that to the office.
Hey everybody, welcome back to the hot seat. Today we have Dr. Badri. He is a foot and ankle specialist. His niche is flat feet, is that correct?
That's correct.
We're going to talk a little bit about flat feet. Honestly, I really don't know much about it, so I'm going to be learning about it as much as you guys are. Why don't we start with the first bite? So the bite's going to be Smoky Bourbon Crazy Swine. This one's 607 Scoville units.
Oh, cheers. First one, cheers. Yeah. All right.
Not too spicy, more sour than spice.
Yeah. A little smoky.
A little smoky.
Yeah.
Yeah. Smoky Bourbon. I like that one. I think my kids will like that one too. So tell me, I've seen all these movies, right? These like World War II movies, World War I movies. The soldier shows up on his first day, and then they're like, you have flat feet, and he goes celebrating, grabs a beer with his friends, he has to go home. What does that mean to have a flat foot?
Having a flat foot essentially is almost like an inefficient foot, right? So if you're marching for 10 miles, you're going to break down at some point, be like, grab your ankle and say, hey, I can't keep going. For a soldier, you're not going to be a very efficient soldier because there's too much movement in the foot that causes tendonitis over time, and essentially you're at risk for injury. And if you're at risk for injury, then you're going to put other people in harm's way. And so you might not be the best candidate as a soldier, but you might be a good swimmer. I'll tell you that much.
Okay. What do you do for that? Is that just like inserts? Like what happens with flat feet?
First thing I like to do with flat feet is I like to evaluate why they develop a flat foot. Is it something congenital? Is it something they had like their parents? Is there a family lineage of flat footness in the whole family? Is it something that's developed over time? And sometimes certain injuries create these type of flat feet, when they're kids. And sometimes, there's some osseous malformations or fusions that occur, like coalitions we call them, that kind of set you up for that, and that's more congenital. And so, my job is to kind of understand the dynamics, the biomechanics of the body. So I look at from the head down, and I kind of evaluate every aspect of every joint to kind of look for mismatching, whether it be tension points in certain muscle tension areas like myofascial tension, one versus the other, like looking at the right leg versus the left leg. Some patients have a flat foot only on one leg. And why is that? And they always ask me, why do I have pain on one foot and not the other? And I'm like, well, it could be how you're leaning on that one side. It could be a structural issue where you have, let's say, scoliosis. It could be something related to how your head sits on the atlas axis. And so you're leaning over on one side. Over time, that kind of creates a whole set of compensation patterns. And so my job is to really unpack that and kind of look at this whole skeleton and kind of see where the vulnerability is. And then, it could be where we might have to do myofascial releases. It could be that, it's an orthotic thing or therapy. It could be some weakness in pelvic floors, or, there's a rotational aspect to the hips or weakness in the hips. And so, my job is to look outside before I look inside the foot and just say, okay, it's just a flat foot,
So does it ever get cured by itself? Like it correct these other things?
If you don't correct these things, it just progresses and worsens.
Okay.
Over time. So once a deformity starts, it only ends in end stage. It depends on how you use it. It's kind of like hitting the brakes. If you hit the brakes too hard all the time, you're going to melt your brake pads, and
okay.
You're going to get to the end very fast. Definitely weight has a major factor because, it kind of causes the ligaments to stretch a little bit further, and you kind of tilt a little more forward because your center of gravity is shifting forward, and that worsens the flat foot essentially. And so definitely weight management is a big issue in this, and obesity and kind of the factors that come with obesity kind of definitely add volumes of problems to the foot itself.
So this is number 2. This is Voodoo. This is 1,240 Scovilles.
Okay.
In theory, it's twice as spicy.
Yeah.
Also half as tasty.
Yeah. It's a little more tangy.
Yeah. Can you tell me about the training that's required to do foot and ankle, right? So I guess you can do it through ortho, or you can do it through podiatry school.
Essentially, there's like 2 different tracks to get to doing foot and ankle surgery, right? When it comes to like the difference between podiatry and orthopedics, podiatry is a branch of orthopedics, so it's not, they kind of run together. The relationship of bones, ligaments, and tendons is orthopedics in general. It just happens to be a more specialized area. I want to focus as an orthopedic surgeon on foot and ankle, it's only like a year of fellowship. So you kind of get breeze through that aspect, as opposed to going very early on in your education and focusing on the foot and ankle conditions and all the different deformities that arise from that, and then looking at the rest of the body and how it kind of connects to the foot.
Okay.
Versus looking at the whole body and then going down to the foot.
Okay.
You know? I did my training at Harvard, where I did more focus on reconstructive surgery, and I trained with both orthopedics and podiatrists, and so I was able to capture the conservative mentality to understand, because maybe the podiatrist might have a more of a conservative approach to different ailments, and the orthopedist is more reconstructive in nature, maybe more surgical, and so I was able to capture and paste together both aspects, so this way I can offer the spectrum of treatment instead of saying, hey, I just do this, no, I'm going to prevent this and I'm going to avoid this, and if I have to fix it, I have the ability to fix it.
Yeah.
And so that's kind of where I see myself kind of in the marketplace, because I try to be a benefit to everybody, and if I can catch you earlier and help people from a younger age, I can prevent some of these problems from in their 30s and 40s, and and essentially keep your function all your life.
I find that in my practice, I do my own free flaps, which is kind of plasticky. I do my own bone plating, and that's kind of ortho-y. And then I do my own bypasses, which is kind of vascular surgery-ish.
Yeah.
So I can appreciate the training aspect, like I definitely see that. I feel that. Let's try number 3.
Mango habanero, 1240.
Okay.
I
Yeah.
feel on the forefront of my tongue.
Yeah.
It's something like you feel it in the back. The back had nothing
Yeah.
for me. It's all in the front. Different types of flat foots,
Mm-hmm.
right? And how might that affect treatment options?
Well, there's different approaches for different types of flat feet. So there's a flexible flat foot, where let's say you can build your arch and create something called a short foot, and it looks like you have an arch, but then you let it go and it's like back to the pancake. Versus the more rigid one, where no matter how much you try to flex it over and build an arch, it just stays flat. I kind of like those a little better, because they're just less symptomatic.
Okay.
Because it's already collapsed and it's already in one place. There's not that extra movement. When you have problems, it's when you have extra movement, because things are firing and twisting and turning, and the tendons are overworking, and so you eventually lead to a tear, degenerative changes over time. So I find more problems with these flexible flat feet.
Is my flat foot the reason that I wear on my sneakers more on the inside?
On the inside, yes, absolutely.
Okay.
It all has to do with how you strike your heel.
Yeah.
So if you strike your heel a little, kind of everted, we call it, where it's kind of falling.
Yeah.
You can kind of wear the shoe on the inside more, and if your heel is more twisted the other way, you're going to wear the outside more. And so part of treating is knowing where to put a wedge, where to put it on the inside or the outside to kind of make a correction. And when you do make a correction, it's not just a correction to the foot, it's a correction to the whole body, because the first strike on the heel predicts what kind of vibrations that occur throughout the whole body. It has these changes that occur in compensation patterns that will start from the heel strike. So heel strike is the most important part of the gait. That will predict what the rest of the foot's going to do and what the rest of the compensation patterns are going to happen around that.
No, that makes sense. I know I used to do this long distance hiking, large swaths of the Appalachian Trail, not the whole thing, but I've done the last 100-mile stretch of Katahdin. I've done a couple 100 miles over in Virginia with Shenandoahs, and when I first started hiking, I was just buying off the shelf boots like Timberlands, and my feet were killing me. Then I went to slightly better boots, and it changed my world. And then I got insoles.
Yeah.
These whatever, they're super feet. They're not paying me. I thought they were pretty good.
Yeah.
And the super feet insoles changed the game.
Mm-hmm.
Like a 20-mile day with correct insoles.
Yeah.
And they're not soft. They're just that arch support.
Yeah.
Wild.
Changed
the game.
Yeah.
So what kind of surgeries do you do for flat foot? So we know insoles. I think everybody
Right.
knows that. I just kind of talked about it myself. But I didn't know there were surgical options, honestly, until we spoke. I haven't had a chance to find out what they are, so maybe you could kind of tell me in the audience what we do.
Absolutely.
Maybe get a little science-y for the medical people and then a little layman's-y for the people that don't know medicine too much.
Yeah, absolutely. And to your point about your hiking story, foot was suffering inefficiency, right? And so you're breaking down sooner. And so part of reconstructive surgery or flat foot is to create more efficiency so that there's a better support system in the foot so that it can carry out all its functions and be able to get to the end, of wherever you're trailing, whether it be on the top of a mountain, your goal is or to perform certain functions like running or other activities. And part of what we do is kind of look at kids early on and kind of look at adults later on and see what kind of predictions that we can make based on their vulnerabilities of their alignment, and we can pretty much determine what kind of disease process or pathogenesis we call it, where there's a process that ends in arthritis and tears. When you're a kid, we try to do minimally invasive surgeries where we're realigning the foot whether by installing little devices in the arch to provide arch support using a very small minimally invasive approach. So usually I have like an age range between, like, let's say if I can get them between 7 or 8 to about 12 years old.
Oh, wow.
It's a different set of procedures that I do,
Okay.
Yeah. Versus if you become 14 years old and you're up to like 25 years old or 30, it's going to be a whole nother set of procedures.
Okay.
And then if you get to, let's say, in your 30s into 40, 50, 60s, that's a whole nother set of procedures. And then later on, even after that, now we're talking about ankle replacements and arthritis that leads to fusions and other things like that. And essentially it steals your independence. Getting involved early is always the best way to handle this. If I see a kid early on and I can change their life and, do something small, minimally invasive, and create a major shift in their life, buy them so much more time. Garlic. All right. Garlic. I do love garlic. I think this might be my favorite.
It might be your favorite. Fantastic.
Yeah.
We'll be found a new one.
Mm-hmm.
You do like regenerative medicine, right? Peptides
Yeah.
and stuff.
Mm-hmm.
So hopefully we can talk about it in a little bit. I saw this one doctor. I don't know the name, so we're not going to poo-poo him on a video. But he was talking about how he treated somebody using PRP and some kind of special PRP for a complete Achilles rupture,
Right.
and healed this guy. And I mean, anatomy is anatomy. Like, it just drove me insane listening to this guy talk. Like, how do you try like a partial rupture? Maybe you put somebody in an AFO or something, and like you just don't let them move, and you get them. But complete rupture that he cured with peptides. Obviously, that is a bunch of baloney. But maybe you could tell us a little bit about the roles of peptides. So you do peptides.
Yeah. So
I don't even know what these peptides are.
So I personally do peptides.
Okay.
And I also develop plans for patients.
And what are these peptides?
Peptides are
Yeah,
pretty much like short chain amino acids.
Okay.
Think of the body as as made up of proteins, right? And so amino acids are the building blocks of these proteins. And so if we go down to the root of your body, of your cells, of everything that's made, everything that's created in your body, it's an amino acid.
And are there a variety of different peptides? I'm sure they have names, right? Is this one specific one that you're doing? Is this?
Yeah.
Is there do people get like how does it work?
First, I like to look at kind of where the vulnerability is. Is it a tendon? Is it a joint? Is it full body pain? Generalized pain. What I like to do is I do like a specific peptide called BPC 157. Okay. And I mix it with TB 500. Okay.
What's that? Another peptide?
It's another peptide.
Okay.
It has different roles. You could think of the peptide to kind of keep it simple. The BPC 157 as the engineer or the architect, and the TB 500 as the worker that's going to actually develop the structure of whatever it is that you're building. In my mind, when I look at longevity, I look at function and I look at tendon, like you talked about the Achilles rupturing, right? Why does it rupture? Because of blood flow. And there's an excessive pull or an excessive force or a nerve imbalance that overfires a muscle, and all of a sudden it pops and it blows in shreds. It's like a bomb went off. Why does it go off there? Why does it tear? Because of blood flow. So when you lack blood flow, you're going to tear something. And so we find that where do we tear things? Usually at when a tendon takes a curve or like a flexes or bends. If it goes at a right angle, any tendon that takes a right angle turn, you're bound to tear that tendon at some point with a certain moment where there's a lack of blood flow in that tendon. Okay, and so BPC 157 to me enhances blood flow throughout the body. And so to me, longevity is blood flow.
All about blood flow.
Yeah.
I love it, right?
Yeah.
I mean, the truth is, half my practice is telling patients after these complex surgeries, they don't get to smoke anymore, they don't get to do coke, they don't get to drink coffee. Basically, they don't get to do anything fun. How do you deliver it? Is it through an IV? Is it like local injections, like directly to the the area where the tendon is? How is it delivered?
Understanding the science of peptides, you understand that peptides are the weakest bonds in nature, right? So they easily break. So they can denature if it's too hot. You know, if it's if you shake it too much, or you know, it's weak bonds, you know, between these amino acids, these short chain amino acids. And so essentially the best way to take it is either through an IV or through direct injection into muscle or subcutaneous tissue. Other mechanisms of entry, and it depends on what you're trying to heal. Like, for example, if you have an ulcer in your stomach, you know, and you want more blood flow, or you want some healing to happen there, then you probably want to ingest it, because that's the target, you know, tissue. That's a vulnerable area.
Number 6.
Cheers. Yeah.
Cheers. Extreme habanero. A little bit late to the party, but he is starting to show his face. Yeah.
That one kicks later. You're right.
Yeah, that kicked later. There was one case in residency where we used to rag on each other.
Yeah.
So, like, I don't know how it is at podiatry residencies, but like general surgery residency, brutal.
Yeah.
Brutal. So, like, if you make a mistake,
Yeah.
everyone's gonna know about it.
Oh.
So, like, we had one case where someone put in a nasogastric tube, and like, it was, you get an X-ray to look for it in the stomach, and it was coiled up in the brain.
Oh.
Like there must have been like a perforation in the ethmoid plate, and like we couldn't let anybody forget that. Or like another scenario where we should have him here. I think I know who it is, but I'm not going to say it. If he's here, though, we'll bring up the story.
Yeah.
Where somebody put in also an OG tube, and 1.5 liters of fluid came out and drained this guy's pleural effusion. So it perforated the esophagus, entered the thorax, drained this guy's pleural effusion. The patient did okay, if memory serves. But we let this guy have it every single time. So yeah, that was always fun. You know, you gotta roll with the punches in residency or fellowship. And you gotta learn, so that way when you get to this stage, you have like a good foundation to build on. Cool. Let's
All right, our next venture here.
ghost pepper.
Ghost pepper. All right.
Doesn't taste too ghosty.
No.
I don't know. I'm not feeling the ghostiness.
No.
So why podiatry?
Well, part of it was I had my own foot issues myself,
Oh, okay.
and I was told I had flat feet, and I would go to doctors and get my feet checked. I was actually in dental school first, and I was like, you know, I had entered dental school, and I just had foot pain. And I didn't understand why. I would go to a few doctors, and they didn't seem to know either. And I was like, you know what? I think I'm just going to specialize in this, because I think I need to know what's going on here, because I think as I get older, I need to know how to help myself. And if I could help myself, I could probably help others.
Yeah, it's fantastic.
Right?
I like
And
it.
so there's a little passion story behind it. And I figured if I had kids, maybe they would have problems too. And I can maybe course through that and find solutions or ways to amplify their life, and find that people, you know, kids with flat feet end up getting stuck on video games and gain weight. I want to make sure that they're not, you know, that they stay active, especially in their mindset and in their body.
Yeah.
And so that was kind of a mission that I took on myself, and I said, hey, this is what I'm going to do.
That's awesome.
Let's do it.
Try this next one over here. So this is number 7. 20,000 Scoville units.
No.
Phantom buffalo wing sauce. This just tastes like somebody was angry that made it. Zero flavor. I taste no buffalo.
No buffalo at all.
No. It just tastes unpleasantness.
Yeah.
And I have to say, the more I'm talking right now, the less happy I am
Yeah.
that we took that bite.
I know. This one I think is the worst one.
Absolutely.
intense.
Yeah.
I think I'm ready to cry.
Oh man, yeah, me too. I got you. Oh man. So that was something. Do you do flat feet as your favorite procedure, or is that something you're good at?
I have very good outcomes. I always ask patients, hey, do you want your flat foot back, or do you like what you have here?
Yeah.
No one's ever told me, hey, I would like to have my flat feet back. I can appreciate the change right away. You know, like sometimes, you know, you go in, let's say I'm doing arthroscopic surgery. It still looks the same. It's an ankle, you know, and it's, you know, painful. I go in arthroscopically, I clean it, I fix it, I do whatever it is, and I don't appreciate a change, you know. But when I do flat foot surgery, immediately on the table, I'm like, wow, this is gonna walk out, you know, doing better right off the table.
Is there any TikTok advice or anything you see kind of floating around social media that you think is just terrible for your foot health that are like touted as being great for your foot health?
Yeah, I mean, there's like a whole segment of like barefoot shoes, you know, that I see that kind of.
I love those. I had those with little toes. I had the vibrant
you have your individual toes,
Yeah.
which there is definitely a place for type of shoes, but from a foot surgeon advice, if you have a deformity, it's going to exaggerate or progress the deformity, right?
So even like flat feet, like we were just talking
Like
about.
we talked about flat feet.
Like you're not talking about like your foot's like this.
Yeah,
right? Like,
so if you
subtle.
have even a flat foot, so if you don't have any support and you're walking, kind of like we were talking
Yeah.
about with hiking, right?
Yeah.
Imagine hiking with barefoot shoes. You know?
Yeah,
I mean, you're not
they
gonna
advertise
get,
them for that. By the
Yeah,
way.
I know.
Like it's ridiculous.
Yeah,
I
like you
tried.
will not get 2 miles in before you'll break down.
The problem actually was the bruises on the bottom of my feet because when you step on the rocks, it's
Yeah.
like you don't think about it when you're wearing a shoe, but like every little twig,
Yeah. Oh,
you know, like you need a rigid sole for hiking, particularly if you're have like a 40-pound pack on or something.
absolutely.
You know, that's insane.
Absolutely. There should be some rigidity to the shoe.
Yeah.
You know, that's why you see hiking shoes. They're more rigid. They're more stable. They have a lot more support because there's a lot of torquing and turning and, you know, tendonitis that can develop from that. So doing barefoot like that, I would say is terrible for you, especially if you have like, you know, flat foot or very high arch foot or ankle, a loose ankle, like an unstable ankle. You're just going to create more problems and, you know, you're going to create pretty much disability very quickly. If you have a normal foot type and you're like, hey, I'm the type I want to keep my foot strong, great, then do the barefoot shoes. But, you know, to kind of overarch, tell everybody that, hey, everybody should be in barefoot shoes, I think there should be limits to that because I don't want to say that there's always a shoe for everybody,
Yeah.
you know, and so I can't just say all barefoot shoes are bad, but certainly, you know, in the right setting, you can put the right person in that and they'll do very well.
Let's try next one.
All right.
Number 9.
Yeah.
Holy brain killer.
Mm-hmm.
25,000 Scoville units.
Yeah. The other one is still humming in there.
Still reminds me.
Yeah.
Still reminds me of those rough days.
Exactly. Those first year residency days.
It reminds me of my first breakup.
Yeah, exactly.
Yep. Oh, 3rd grade. Lena Escobar.
Yeah. Oh.
I'm just playing. Social media videos, they always love talking about what you should start doing, what you should stop doing. Like, you know, the ER docs, like, what should you never do? Never go on a trampoline, right? What do you think people should do for their foot health or stop doing for their foot health?
Right.
As a foot surgeon.
Absolutely. I think the first thing that you need to stop as a foot patient is stop putting your foot in vinegar and coming to see your doctor. You know, because, you know, well, I had a patient tell me one day, he's like, I went to this doctor and he gave me advice. He's like, you know, put your foot in vinegar. He's like, Doc, what am I trying to make a salad with my foot? You know, he's like, you know, you can do that at home, but don't bring that to the office.
Yeah, leave that vinegar.
Leave that vinegar there because
Yeah,
you're gonna kill me someday.
No, that works.
Yeah. So I would say that would be something that, you know, we doctors appreciate. You know,
Yeah.
come in without vinegar.
Yeah,
But,
I think so too. Don't put anything in vinegar.
Yeah, exactly. Yeah, I don't think that works.
Don't drink it.
Yeah.
You know, it reminds me. I went to Whole Foods once. They're like giving it like apple cider
Yeah.
vinegar. And they're like, here, have a shot of this. And I try not to tell them I'm a doctor or be
Yeah.
rude. I'm like, well, why would I want to do this? And they're like, well, it's good for you.
Yeah.
I'm like, well, why? What do you mean it's good for you? Like,
Yeah.
drinking acid. Like, let's like ask any doctor.
Yeah.
It just so happens that I'm a doctor.
Yeah.
Like nothing about this. I think this is a terrible idea. Oh man, oh, that's craziness.
Yeah.
Are you ready to try number 10?
Yeah, we're there. Let's do it.
You made it. Peach ghost pepper.
Interesting.
It's kind of nice.
It's nice. Yeah.
Dr.
It's a lot of fun.
Thank you for coming.
Thank you so much.
Pleasure
Thanks for having me.
Take care.
It was a good time.